Hello and welcome to my case study on the health challenges in the Kingdom of Eswatini. First, let's cover some important historical background about the country of Eswatini. It was founded in the 15th century by East African migrants and tribesmen and was a British colony until the late 19th century. It was granted its independence from that country in 1968 and was ruled for 83 years by King Sabuza II, Africa's longest reigning monarch. It's currently ruled by King Mswati III, and he recently established a constitution there in the country guaranteeing certain rights in 2006. A quick overview of the country will show that it's a small landlocked country situated on the border of Mozambique and South Africa. Its population is about 1.5 million people who subsist on a relatively modest income annually of about $1,500. It has significant infrastructure throughout the country though, primarily as a result of its being a former British colony. We should also note that the population is starkly divided between urban and rural, and that land ownership remains in the hands of the king. And so all the lands of the country are crown lands that are, in some cases, subsistence farmed. This tiny African nation sticks out for all the wrong reasons when we look at health factors. According to all the major health monitoring organizations in the world, Eswatini has the highest rates of HIV and AIDS infection in the world, with nearly 26% of the adult population infected. Additionally, tuberculosis infections are on the rise, with Eswatini having passed Botswana recently for the highest incidence rates in the world. The co-infection rates of both of these diseases in patients who possess HIV is greater than 80%. When you couple that with low contraceptive use rates in the country, even though they're higher than many of their African neighbors, you see that it leads to really low life expectancy rates and terrible health outcomes. Despite this really grim news that we know with respect to HIV and AIDS, there are some positive steps that we see with respect to health outcomes in the country. In 2018, PEPFAR reported that 85% of the population living in the country with HIV know their status, and that of those, 87% are on ART therapies, with nearly 92% of those having achieved viral load suppressions. The Centers for Disease Control in the U.S. reports that since 2006, the prevalence of HIV/AIDS in the country has declined amongst the youngest population, aged 25 years old and less. We also see high immunization rates for other diseases amongst younger subsets of the population, with 1-year-olds in the country having achieved a greater than 90% vaccination rate for DTP, an important early childhood immunization. We also know that inequality and poverty indicators in the country indicate really troubling statistics that exacerbate the health problems in the country. When we look, we see that 42% of the country lives on less than $1.90 a day, and that the poverty split between rural and urban is really deep, with 73% of the rural population considered poor versus 31% of the urban population. We also know that the gender balance in the country in important institutions such as Parliament is way out of line, with only 14% of the parliamentary seats being held by women. And so you see the HDI and the Gini scores in the country really take hits. Societal indicators in the country also indicate some problems for us. We talked a little bit about the rural and urban divide, and wealth tends to be concentrated along those lines as well, with the urban areas possessing the vast majority of wealth in the country. We also know that due to the HIV/AIDS crisis, a large percentage of the population are composed of either widows or orphans, and that a large number of children end up caring for children in the country. And so families are really devastated and broken by this really looming health crisis in the country. Additionally, the health and education sectors have been especially hit hard by a brain drain, with many of the working age population and educated population in the country moving to surrounding countries like South Africa and Mozambique in order for their future job prospects to kind of pan out. Energy access in the country is also very poor, with less than 27% of the population having access to clean, affordable electricity compared to 40% in urban areas. Water infrastructure is relatively poor, with 25% of the population living on unimproved water systems, and sanitation systems in the country are not up to spec, with nearly 60% of the population served by improved systems versus 40% of the country being on unimproved systems. Complicating the scenario is really a bad set of employment indicators for the country with high unemployment numbers. When we examine the overall population, we see that 26% of the country represents an unemployed population. Youth numbers are even greater, with more than 53% of those 30 and younger being unemployed. Child labor is also an issue in the country, with nearly 7% of the childhood population working or being in the child labor pool, according to UN Development Program. We also know that big chunks of the population are engaged as smallhold farmers or subsistence farmers on crown lands. What we see with Eswatini is a country really in crisis, in substantial long-term crisis. Its health crisis obviously sticks out to us as HIV/AIDS ravages the country, with large swaths of the population subject to this horrible disease. We know that there are steps being made as vaccines and antiretroviral therapies are being widely distributed in the country, but low rates of contraceptive use still make transmission an issue. This is complicated by an economic system in the country which is failing for the most part, as the young and employable population of the country tends to leave for South Africa or Mozambique to bring money back to their families, and it creates a brain drain, if you will. There are reasons for hope. Lots of nonprofits are active in this space, lots of nonprofits, and the UN Development Program, for instance, are active in the country, but we still see real tragedy with a huge percentage of the population infected, and in fact many of them having been wiped out by this terrible disease.